These clients have volunteered to participate in these face-to-face interviews, which poignantly convey what it is like to live with a psychological disorder. Psychological disorders must be seen to be understood. We urge you to take note of the facial expressions, speech patterns, emotional expressiveness, body language, and other intangibles that convey in a way words simply can't the overall impact of a mental disorder on a human being. You may be surprised to witness the client's strength and humor, even in the face of long-term psychological disorders. But perhaps this should not be surprising at all. For the central truth these interviews demonstrate most effectively is that people are larger than their disorders.
My name is John Cernansky, and I'm a psychiatrist. Abnormal psychology is the study of abnormal mental processes and abnormal mental phenomena. When these processes or phenomena group together in particular ways, we can also call that a diagnosis. Diagnosis is also a shorthand term. It allows us to communicate in a word or two to a patient or to their family or to other mental health professionals a great deal of information. We can describe the kinds of symptoms that might be likely to be present, the kinds of treatments that would be most helpful, and the potential outcomes for any given problem. What you'll be seeing is a series of 10 interviews. We'd like to demonstrate for you how a mental health professional collects the information needed to make a diagnosis. Some of the people being interviewed are inpatients, and others are outpatients, and they vary in the clinical severity of their problems. Also, there is a variety in the way in which biological, psychological, or social factors influence the problems that you'll see. These interviews are conducted by seasoned and experienced clinicians, and you'll notice that their styles vary. Sometimes a difference in style is dictated by the person being interviewed and their particular problem. Other times it's just a difference in the style of the interviewer. Finally, we've obviously made a film, and we've made no attempt to hide the camera or other film equipment or personnel from the person being interviewed or from the interviewer. And you'll notice that this film environment has an effect on several of the interviews. And now let's begin with the first interview. Barbara is suffering from an episode of major depression. She also has a long history of changes in mood. Her internal experience is one of loss of purpose and low energy. These symptoms have also disrupted her relationships with her family and friends. One of the most notable symptoms in this interview is her suicidal thoughts. Well, Barbara, I guess we're both a little nervous today. Is this the first time that you've been interviewed while being videotaped?
Yes.
Do you feel okay about that? Is there anything we can do to make the situation more comfortable?
No, it's just kind of nervous. I'm fine.
Okay. This will be an ordinary interview, just like we've had before, although we haven't been videotaped before. How long have you been feeling poorly, and what's that like for you?
I think I figured out that I've been sad, depressed, most of my life. I can remember times, I told you, I think before, that I had a headache in high school for a year and a half. And I think that's kind of when it started. And then there have been different periods in my life when I remember being so down I wanted to end it all. And then that kind of went away. I haven't felt suicidal like every day for all 46 years, but there have been periods when it's been particularly bad.
Is this one of those periods?
Yeah, I've been having a really bad time since May. I can't, there doesn't seem to be a reason for it.
Okay. How many months total would that be since May?
Since May, I guess that's
About
6
4 or
months.
5 months.
Yeah.
About 4 or 5 months, okay. What was the first thing that you noticed in May that gave you the signal that you were heading down again?
I got mad at my children. I went to bed for 2 days.
So was irritability one of the early symptoms? What did you do when you went to bed for 2 days?
I locked my door and I stayed in there for 2 days, and I came out when they went to bed and were asleep. So I came out and ate like at 4 in the morning and then went back upstairs.
Mm-hmm. What was your mood like during that
I
period?
was suicidal. I was a wreck. I was mad at myself because I put myself in that position. I was mad at them because they didn't care enough to come and get me out of my room.
Mm-hmm.
I didn't know how to end it.
Mm-hmm.
You know, I mean, I went to my room and I closed the door because I was angry, and then I didn't know how to come out.
I want to understand more exactly what you mean by feeling depressed. What does depression mean to you?
Physically, I'm lethargic to the point of not wanting to get out of bed,
Mm-hmm.
not wanting to shower. If my children aren't home like they've been in college, I sometimes stay in bed in the past for a couple of days,
Mm-hmm.
on and off. If I'm not working, and I can do that. I feel like my arms are so heavy, I cannot lift them.
Mm-hmm.
If I can move myself to the couch downstairs and turn the TV on, that's like a big deal.
Mm-hmm.
And then it's so bad that I won't even get up and change the channel, nor will I get up and get the remote to change the channel.
I see.
I mean, it's really dumb, and I sit and play games with myself about, now as soon as this commercial's over, you're going to get up and change the channel.
Mm-hmm.
And I don't.
How do you feel about yourself?
Oh, I hate me. I really hate me. I hate the way I look. I hate the way I feel. I hate the way I talk to other people.
Do you find yourself feeling guilty about things?
All the time. I do everything wrong.
Do you find yourself feeling guilty about things far in the past that are
Yeah,
way past doing anything
like
about?
20, 30 years ago, something I said to somebody that hurt their feelings and I didn't mean to do.
Do you have much, when you're feeling that way, do you have much hope for the future? Is there any hope in your view, or is that gone?
The only hope I had, the only thing I was hanging on to all these years was I was waiting for my children to get through college
Mm-hmm.
so that I could be done. I felt that that was kind of a goal that I wanted to get to,
Mm-hmm.
and it's done. And I don't know where else to go. I have to find something else to do with me,
Yeah,
because there just isn't anything to do.
right. So you feel like
Really
don't have much of a
hopeless.
purpose.
No, yeah, nothing,
There's no purpose now
right.
for you. You mentioned feeling suicidal. Has that been every day? Has that feeling stayed with you throughout the 5 months?
It's almost every day. I try not to concentrate on it like, this is Thursday, am I going to think about it today? But I do find it almost every day that I think this just isn't worth it, this hurt, this pain, this...
Yeah. Have you thought of a particular way to hurt yourself, or have you thought of hurting yourself, or killing yourself?
When I drive, I think I'm going to drive off the side of the road. What I'm really worried about is that I'm afraid I wouldn't die,
Mm-hmm.
and that I would just be hurt, and that would be worse for my family.
I see. Do you have to fight off the impulse to turn your car off the road at times?
Yeah, sometimes. Not this week,
Great.
but I have in the past. I drove onto the shoulder of the road a couple of times and stopped, just crying, sobbing.
Right. Do you cry? I noticed that you were a little
All the time.
tearful a minute ago. Do you cry a lot at home?
All the time. All the time. It's almost uncontrollable.
Yeah.
I mean, I cry about stupid things.
Right. How about other physical symptoms that sometimes go with depression? Have you noticed any change in your appetite, either an increase or decrease? Any change in your weight, either an increase or decrease?
Well, no. I've been gaining for the last couple of years, and I've been trying to do something about that, but I feel so bad about me, it's really hard to.
Does
to
that
do
seem
that.
to change? Does your weight change or your appetite change when you're more or less depressed?
I usually eat more because I think that's going to make me feel better.
How about your sleep? Is your sleep disturbed?
I've been having trouble with my sleep, I guess, for quite a while. I wake up in the middle of the night.
Do you ever wake up at 4 or 5 in the morning and you're unable to get back to sleep?
Absolutely.
How do you feel? What's in your mind when you wake up at 4 or 5 in the morning?
I'm really tired. I'm physically heavy.
How about your sex drive?
I don't have one anymore,
Okay.
but I'm not sexually active.
But that's gone. Or
Yeah.
very diminished.
Do these episodes of feeling depressed, do they come at a particular time of year?
I haven't been able to pinpoint that there's.
When you feel depressed, how does that affect your relationships with other people?
I have been systematically getting rid of my friends and my family, other than my children, one by one, over the past several years. I now will not answer my phone and will not answer my door. I figured out that I own the phone, and if I don't want to answer it, I don't have to. And I own my door in my house, and if I don't want to, if I don't know that someone is coming, I don't answer the door.
What feeling prompts you to shut the door or not answer the phone?
I'm afraid. I'm scared to death that they're going to ask me to do something, and then I won't be able to say no. I have a hard time saying. I'm afraid somebody's going to say, "You want to go to the movies? Do you want to go see a show? Do you want to go shopping?"
Okay, and let's say they asked that. How would that make you feel if they asked you to go to the movies?
Like I had to do it.
And if you did it? You went to
I
the
don't
movies?
want to do it.
Is there anything you can get pleasure out of doing?
There isn't anything I want to do. I work sometimes, and I'm okay once I get there, but the process of getting up and showering and getting dressed and leaving the house is just almost more than I can do.
Let's switch gears just a bit. Can you estimate the number of times you've felt depressed in your life since you've been a teenager?
Between 15 and 20, maybe.
Okay.
And I'm really just guessing, because if I could be more accurate about that if I sat down and remembered all the times, because I can remember sporadic things that, I felt really, times when I felt really, really bad for a year or a year and a half.
Mm-hmm. Mm-hmm.
But I'm just kind of guessing.
That's okay. That's okay. In between those times, do you feel normal? Do you feel yourself?
I don't know exactly what normal is. I thought everybody felt like this all the time. Just in talking to other people, I thought everybody kind of felt suicidal at times. I thought that was a very real thing that everybody felt. I didn't know that some people never, ever think about that.
Are there times, between the times that you're depressed, when you don't feel guilty, you don't have a low energy, and you're not crying?
Yes.
Are there
I've
periods
had
of
some,
time like
yes.
that?
I've had some very productive times in my life where I worked real hard and felt real good about it, and felt good about my family and thought things were going to be okay. And
Barbara shows us many of the most characteristic symptoms of depression. She has guilt, she has low energy, hopelessness, she had suicidal thoughts, although fortunately not current in the interview. She describes a characteristic sleep disturbance in that she wakes early in the morning. Her disturbance in appetite and weight, though, is rather atypical in that she tends to gain weight at times when she's depressed. Besides this episode of depression that seems to have lasted several months, she also has a long history of changes in mood. For this reason, it's important to determine at some later date whether she may also have dysthymia or even perhaps a personality disorder. It's very difficult to make that assessment now because of her current depressed state. But when this depressed state remits, when it goes away, we'll be able to see more clearly what her long-term history is like. Also notice that she has no psychotic symptoms and no symptoms, either in the present or the past, of mania. For this reason, we would diagnose her as having unipolar depression without psychosis. The symptoms that she has have obviously affected her behavior in dramatic ways. It probably has impaired her ability to work. She withdraws at times completely from her friends and family. This isolation can lead to further depression as she goes deeper and deeper into this depressed state. Finally, it's notable that we need to be paying more and more attention to illnesses like depression. It's one of the most common psychiatric disorders, and it's approximately 2 times more common in women than men. Mary suffers from bipolar disorder, also called manic depressive illness. When we first interviewed her, she was in the depressed phase of her illness. And then, quite surprisingly, 3 days later, she switched into the manic phase. And so we have the opportunity to show you Mary in both phases of her illness. Please note that certain psychotic symptoms are present in both phases.
We could talk a little bit about the night you had last night. You
Oh,
really
it
had
was
a rough
terrible.
night.
Yes.
Yeah. How did it start? I mean, you mentioned a little bit to me when I came onto the floor this morning.
Well, I was having like a revelation, and the devil was saying something to me. Go get her. She tried to sleep with you. But again, I didn't want to hurt her. But I did.
Mm-hmm. And you mentioned voices this morning.
Yeah, I hear lots of voices.
Yeah. And they said something to you about her?
Yeah,
What did they say?
go get her.
Go get her. They say anything else?
You had to kill the devil.
Okay. So you thought she was the devil?
Yeah,
Okay. Has that happened before?
yeah.
You got a message like that somebody was evil.
Out to get me.
Yeah.
Yeah.
Why would they be trying to get you?
I don't know.
Have you put together any thoughts about that? I mean, is it because of something that you have or any special position you have in the world?
I feel like I'm on top of the world, looking down on creation, and the only explanation I can find is the love that I've found ever since you've been around, is to put me on the top of the world.
So they're trying to get you because you're on top?
Yeah.
Yeah. Is there somebody in particular out there who's trying to get you?
All I can say is the devil.
The devil. Is it kind of like a battle of good against evil?
Yeah.
Okay. Do you have anybody on your side?
Yeah. Jesus Christ.
Okay. Okay. What's your relationship to Jesus Christ?
He's my Father.
Okay. I mean, a lot of people say Jesus Christ is their Father. Do you have a special relationship with Him right now?
Yes.
Can you say a little about that?
Just that I'm getting dizzy.
You got sidetracked there. Can you tell me what you were thinking, or were you hearing something?
No. feel like I'm being judged all the time. And I've always said, judge lest ye be judged.
Uh-huh. Who's judging you?
People.
People. Does this situation feel tough to you because of that, feeling judged?
Yeah,
Like kind of like you're being observed or,
a little bit.
Okay. Let me know if it starts to feel uncomfortable because, of course, we're just doing this to do a training or a
Yeah.
teaching thing. But if it starts to fit into some of those other feelings you've had before, it might start to feel uncomfortable. Just let me know if that starts to happen.
Okay.
Just then, were you hearing any voices?
No,
You seem to get distracted a little bit.
I think it's because I have a disease of the brain.
Uh-huh.
There's something wrong with my brain.
What do you think it is?
I want to be a little kid again instead of a grown-up.
Mm-hmm.
Because everything was so calm and cool and collected when I was a little kid, except for when my dad was beating me up.
Yeah, well, that doesn't sound good.
Sometimes I think I'm possessed.
Who are you possessed by?
I don't know.
By someone or something good or
Yeah,
someone or something evil?
something both.
Both.
Sometimes I can't detect which is which, because I shouldn't have done what I did last night. God knows I shouldn't have done that.
Sounds like you feel pretty bad about it.
She was just a little girl.
Mm-hmm. You're worried that you hurt her? I think she's okay. I heard she's okay.
Then I hit that one guy.
This was all part of the same thing last night.
No, this was,
Oh, a different time?
I went into his room and punched him in the face. His name is Mark.
What was going on there?
I went outside and put my hands up in the air like this,
Mm-hmm.
and everybody was scared and cussing at me and what have you, and he was standing in the way where they couldn't see me. He made me mad. Then I had this feeling I wanted to be with him. Sexually.
Mm-hmm.
And that made me sad and happy, a whole bunch of different feelings all at one time.
Mm-hmm.
Because I hadn't had that feeling with my husband in a long time, like I did when we first met.
Mm-hmm.
It's a conflict between my husband, too, and the world.
In between these episodes that are happening now, I guess every year or every other year, that everything goes back to normal.
Yeah. When I don't take my medicine, though,
But when you don't take your medicine,
it happens again.
okay. When you are taking your medicine, though, is there still this kind of active battle between good and evil going on?
Yeah.
Can you hear anybody's voice at those times? Do you hear voices
Yeah.
when you're on your medicine,
No.
in between the flare-ups?
Yeah, in between the flare-ups.
You do hear voices?
Yeah.
But it stops when you're on your medicine?
Right.
Okay. And how long does it stay away for?
Till I stop taking my medicine.
So it could be months and months or
Yeah.
even a couple of years.
Well, see, like the first time I got sick was 85.
Uh-huh.
And it separated itself for 3 years. I figured 85 was the devil. He had me stinging from head to toe.
Mm-hmm.
I was so stoned. It wasn't funny. My husband jabbed me in the left shoulder blade like that, trying to get him off my back.
Mm-hmm.
And then I believe it was God who came again to me in 1988, which was separated from the devil for 3 years. And then he came again in 1990, in 1992, and now in 1993.
But in between those times, no devil. Okay. And what's your mood like in between those times?
On top of the world.
I mean, when you're taking your medicine,
Mm-hmm.
do you feel high or just normal?
Normal.
Just normal. Okay. How would you describe how you're feeling now?
A little scared. A little anxious. See, there's so many things. I believe God sits up there and smokes. I believe he sits up there and smokes pot. I believe he sits up there and smokes cigarettes. I even believe he snorts cocaine.
Were there periods where you've had weeks where you were sad? Not on top of the world.
Yeah.
Not like you are now.
Being fat and ugly. Didn't want to live anymore in this world.
When was the last time you went through a period like that?
This time.
This time.
Yeah.
Okay. Feeling like you didn't want to live anymore.
Yeah.
How long would those feelings last?
For a year.
For a year. When was that?
1992.
92. Can you think of a few weeks in there where it was really at its worst?
Yeah.
What did you do during those weeks?
Smoked dope.
Smoked dope. Did that get you through it?
Yeah.
Did you have to see a doctor or go into the hospital at all?
Eventually, yes.
Okay. You have a bandage on your hand. Can you say something about what happened?
My husband.
Mm-hmm.
I think he plays around on me.
What makes you think that?
Because of all the things I see.
Is that related to the bandage?
Yeah.
How is it related?
I burned my heart.
You burned your heart. Now, last week when I saw you, there were 3 round circles there and there was no bandage.
Yeah.
How did you get the circles?
With the ashes.
From a cigarette?
Yeah.
Okay. And you were burning it kind of like you were burning your heart
Yeah.
because you were sad?
These clients have volunteered to participate in these face-to-face interviews, which poignantly convey what it is like to live with a psychological disorder. Psychological disorders must be seen to be understood. We urge you to take note of the facial expressions, speech patterns, emotional expressiveness, body language, and other intangibles that convey, in a way words simply can't, the overall impact of a mental disorder on a human being. You may be surprised to witness the client's strength and humor, even in the face of long-term psychological disorders. But perhaps this should not be surprising at all. For the central truth these interviews demonstrate most effectively is that people are larger than their disorders.
My name is John Cernansky, and I'm a psychiatrist. Abnormal psychology is the study of abnormal mental processes and abnormal mental phenomena. When these processes or phenomena group together in particular ways, we can also call that a diagnosis. Diagnosis is also a shorthand term. It allows us to communicate in a word or two to a patient or to their family or to other mental health professionals a great deal of information. We can describe the kinds of symptoms that might be likely to be present, the kinds of treatments that would be most helpful, and the potential outcomes for any given problem. What you'll be seeing is a series of 10 interviews. We'd like to demonstrate for you how a mental health professional collects the information needed to make a diagnosis. Some of the people being interviewed are inpatients, and others are outpatients, and they vary in the clinical severity of their problems. Also, there is a variety in the way in which biological, psychological, or social factors influence the problems that you'll see. These interviews are conducted by seasoned and experienced clinicians, and you'll notice that their styles vary. Sometimes a difference in style is dictated by the person being interviewed and their particular problem. Other times it's just a difference in the style of the interviewer. Finally, we've obviously made a film, And we've made no attempt to hide the camera or other film equipment or personnel from the person being interviewed or from the interviewer. And you'll notice that this film environment has an effect on several of the interviews. And now let's begin with the first interview. Barbara is suffering from an episode of major depression. She also has a long history of changes in mood. Her internal experience is one of loss of purpose and low energy. These symptoms have also disrupted her relationships with her family and friends. One of the most notable symptoms in this interview is her suicidal thoughts.
Well, Barbara, I guess we're both a little nervous today. Is this the first time that you've been interviewed while being videotaped?
Yes.
Do you feel okay about that? Is there anything we can do to make the situation more comfortable?
No, it's just kind of nervous. I'm fine.
Okay. This will be an ordinary interview, just like we've had before, although we haven't been videotaped before. How long have you been feeling poorly, and what's that like for you?
I think I figured out that I've been sad, depressed, most of my life. I can remember times, I told you, I think,
11 years old, and they had to take out her backbone, 8 inches of her backbone out to kill the cancerous tumor. So that means she was paralyzed from her breast down for 21 years of her life. She died the age of the year I was born, 61. I believe everything has a purpose under heaven.
Yeah, what do you make of that?
I believe that's the time that God wrote down she was going to die. Before she hit her 62nd birthday, she was going to die and be my guardian angel at 61 of the year I was born.
You mentioned the other day that drinking coffee, something happens to you.
I get drunk on it.
Let's say something about that.
I can get drunk on coffee. I can get drunk on water. I can get drunk on Kool-Aid. I can get drunk on lots of things.
Now, can you get drunk on those things at all times or only at certain times in your
When
life?
I'm high.
When you're having one of these up periods? Yeah. Are there times when being up like this is unpleasant?
It always feels good. Never feels unpleasant at all, except for when I can't go to sleep because of it. When I'm too up and I cannot sleep. That's the only bad part about it.
How did you sleep last night?
Worth a damn.
Not good.
No.
How many hours?
I didn't sleep at all. I just rested.
Even though you didn't sleep last night, you still have good energy?
Oh, yeah.
Do you feel as good as if you had gotten a full night's rest?
Oh, yeah. Big time.
Okay. Were you able this morning, feeling this good, were you able to concentrate on things that you wanted to concentrate on?
Sure was. I helped him put some stuff away.
Okay.
I folded laundry.
Okay.
I stocked socks together.
Okay. Do you think that if you were outside the hospital right now, you'd be able to do all the things that you needed to do?
Oh, yeah.
Sometimes when you're feeling this good, do you go out and do things that get you into some kind of trouble?
Oh, sure.
Like what?
Mess around on my husband.
Okay. And it gets you into trouble?
Big time.
Yeah. Okay.
And the voices, my gosh, can I hear the voices?
Talk about the voices.
It's what's around me, like up at the front desk. People outside my window, I can hear them all.
Now, are these voices of people that you can't see?
Right.
Okay. What kinds of things are they saying?
Well, that's none of my business, really.
Is there anything else that you want to mention?
Yes, I'm a morphodite.
Yes, talk about that. You mentioned that to me one time.
Okay. I'm a male and a female mixed.
Okay.
I have both organs. And I believe that that's the way God is up in heaven.
Okay. Mary, I want to thank you for coming back. So we've covered a lot of things.
Yeah.
Okay. Thanks again.
You're welcome.
Okay.
And cut.
You've just seen two very dramatically different interviews. In the first, Mary was in the depressed phase of her bipolar disorder. Her mood was clearly down, her movements were slowed, and she described a lot of guilty thoughts. She also had done something self-destructive shortly before that interview. You remember the burn marks on her hand. In the second interview, she was in the manic phase of her illness. Her speech was pressured, she was expansive, distractible. You remember that she talked to the camera a couple of times. She also has a typical thought disorder which we call flight of ideas. That is, she jumps from one point to another too quickly for the interviewer or any of us to follow. There were certain psychotic symptoms that were present in both states, although she talked about them much more in the manic phase. These involved being on a special mission from God, being a special agent from God, and being two sexes in the same body. Delusions of this kind are very common in bipolar disorder. It's important to distinguish Mary's illness or diagnosis from other psychotic disorders like schizophrenia and schizoaffective disorder. These other illnesses are characterized by periods of psychotic behavior or psychotic symptoms when there is no abnormal mood. That means no depression, no elation, or no irritability. However, in this interview, we were able to learn that Mary's psychotic symptoms seemed to occur only when her mood was either depressed or elated. For this reason, we can diagnose Mary as having bipolar disorder. Her symptoms have had a profound effect on her own behavior and on her friends and family. Because of her destructive behaviors when she's manic, she could lose her husband, it could drive friends away, and she has assaulted other people. Finally, it's important to understand that bipolar disorder does not discriminate among the genders or among special populations. Anybody from any walk of life, from any socioeconomic class, can get this serious mental disorder. Clark has a complicated sexual problem. He really has two complaints: a loss of interest and poor performance. You'll also see that the causes of his problem are probably many, both biological and psychological. Finally, be patient. It takes a while for Clark to begin to talk about his problem.
Thank you very much for coming and being with us here today. I appreciate your coming here and spending the time. Can you tell me what your main problem is at this point in time?
As it relates to depression and feeling, I think probably just an ongoing, what I call light case of depression. It seems that it never goes away. It seems that it's always around. At some level or another, the level changes some, but it's just fairly consistent. It may get worse when situations occur, maybe better, but it seems always to be present.
And how long has this mood that's not a full-blown depression, but a somewhat depressed feeling been with you?
Let's see, I remember first identifying depression situationally in 1977, and that's been several years now, hasn't it? And that was a situational condition in my family. I raised a very troubled family, and children got in trouble and bad trouble, and I began to identify depression as a response to that. And for about a year, I felt I was really depressed. Basically, always looking at it as a situational kind of thing. Then, how do I say it? Part of that never went away.
What symptoms did you have in '77?
I think basically the feelings that I had. It was of not wanting to go to work, wanting to stay in the house and not leave, and had to force myself to go and meet people and visit with people and confront people.
Did you feel like crying? Was your mood
yes, at times, yes. Just very, I cried an awful lot during that time.
And did you have any thought of suicide at that time?
No, I've never really entertained any thoughts of suicide. It should have occurred then. If it would have, I would think. But it was a feeling of loss, and a feeling of I felt that I had lost a reputation, character, maybe career. And it was a terrible grief type. I guess that's how I would define it.
And did it include disturbance in sleep, appetite, energy level, concentration?
Energy level, concentration, definitely. And you know I'm clergy, and which is a very public profession, and the people said they could hear it in the presentations I made, the Sunday services, the sermons, that kind of thing. When I felt I was, I really wasn't expressing it. They felt that they could hear it. Energy level was low.
During the time you were depressed, were there changes in sexual functioning?
During that time, I don't remember a whole lot. Eventually, there was change in sexual function, but most of that's been within the last 5 years. There's been some sexual slowdown that really, you know, I don't know how much I can attribute that to depression. Part of it I have to attribute to physical, serious prostate infection, some of those things, and but I don't know how much I attribute that to emotional condition.
How long have you had prostate infections?
It started in 1980. I remember because I was changing jobs at that time, and it was lower back pain, and I thought it was a back and bone problem, and it must have been 6 months, and we worried about that, and then I discovered that it was a prostate infection, which became chronic.
Do you have any other medical problems, such as diabetes, including problems with thirst and urinating more than usual?
Only a few things, you know. Within the last 2 years, cataract surgery in both eyes and some stuff like that.
Any circulation problems at all? Chest pains, pains in your legs when you walk?
Yes, I have an arthritic condition. The lower back, both knees are the worst place, and there has been for a number of years circulations, poor circulation in my legs.
What kinds of sexual problems have you had in the last 5 years?
I think I'm simply just as not as my sexual drive has just declined.
So it's a change in the level of desire, or
Yes.
is it also a change in the ability to maintain an erection? Or?
Has been both. I think probably the change in the ability to maintain an erection was worse when the prostate infection was bad. But I can't attribute all of it to that. The change in desire, or the change in arousal cannot be totally attributed to that.
And any other things that go along with that, such as change in dreams, or not waking up with an erection, or any other kind of general indicator of?
Yes, it is not as common for me to wake up with an erection as it used to be some years ago. And I don't know, people argue about, you know, what happens to a 60-year-old person, and I really don't know. I think probably the biggest crisis was with both the low-grade depression and the enlarged prostate, which was causing malfunction, and that was a couple of years ago. Maybe a year ago. I don't know just exactly how long ago.
Have you had pain with intercourse? You know, with part of the infections, has that been a component, or has that not been
Yes, it
involved?
was for a while.
But not currently.
And burning, tremendous burning.
And has that had an effect on the sexual functioning, or has there still been an ongoing
The sexual
problem?
functioning is better. I don't have the pain. I don't have as serious a problem of maintaining the erection, and there was a what do you call it, premature ejaculation, I just simply couldn't understand. In the process of becoming aroused, all of a sudden it would be over. And I didn't understand that at all. So then everything is coupled with a bunch of depressing thoughts, like the fear of failure.
Right.
So I began to say, is this happening to me because I'm afraid I'm going to fail, and I don't want to be embarrassed by that? And it's really very difficult emotionally to deal with.
But that has stopped. The premature ejaculation has
Yes,
stopped.
yes.
And the pain has stopped.
The pain has stopped.
And what the main problem now is less arousal. Is
Right.
that- And some difficulty maintaining an erection. Is that
Some, yes, I think some. There have been some times lately when I've had difficulty.
Does that seem to change at all with depression? Is there a connection between a phase, say, when you're a little more depressed and having more sexual difficulty, or do they seem to be unrelated?
I haven't really thought about the connection, regularly. I'm sure it has some effect, and I don't know. It has to have some connection, because when I'm depressed, my spirit is not good. My feeling about myself, I shouldn't be this way. I'm a intelligent, capable, professional person, and I shouldn't be having this problem. And the worse I feel about myself, the slower I am sexually. And sometimes I describe it as the fear of losing masculinity, which is a tremendous fear with me. And depression has to have something to do with it. It has to be a contributing factor somehow. How much, I don't know. How much of it is physical, how much of it is emotional, how much to attribute to this, that, or something else.
Right, certainly there seem to be a number of different factors, possibly some circulatory involvement. Now that the prostate is cleared up, you can see clearly that was involved as well. Depression seems to be involved to some extent.
Sometimes I think some of the medications I've taken have affected me sexually as well. And it seems to me there was at least one antidepressant that I felt really affected it.
Do you think you had started to say something, I think before I interrupted you, about how you were worried about masculinity. Is that connected with depression? Is that thought connected with depression, do you think?
I mean, yes, in some ways, I think. I think how do I just put it? A real man oughtn't to feel this way. Ought to have more strength. I don't want to be weak.
Pull yourself by your
That's right.
bootstraps.
And maybe that goes back to many of much of the stuff that was put in my head as I was growing up about what a man is in our culture and what a man does and how a man functions and so on. Man doesn't cry, for instance, and I find myself crying, which pushes me deeper into the whole thing and frustrates me highly. And there has to be something about it has affected my concept of who I am, and particularly around the strength. I'm a weakling, you know, and that's it's kind of hard thought to live with.
How about your relationship with your wife?
I think, you know, if we're going to talk about sexual dysfunction and how that affects me emotionally, we need to say something about Julia. She is a gorgeous 42-year-old woman. And when I find myself not being able to function sexually, that has some effect, you see, of who she is and how I ought to be around her. And that causes me to say, hey, you know, yeah, you're not much of a man.
And so the two intersect in the sense of feeling diminished, that the
Yes,
depression
yes.
diminishes you, and any kind of sexual difficulty diminishes
Also,
you.
also it contributes to it,
Mm-hmm.
and it has really changed my attitude and my ability to deal with things, and I've really struggled with that whole thing, and still am.
You've heard Clark describe two problems, a loss of interest and an inability to maintain an erection. For this reason, he meets the criteria for two different DSM-IV sexual function disorders: male hypoactive sexual desire disorder and male erectile disorder. In the case of the first problem, the causes are many, but probably psychological. He's had a major depression in the past, and he still suffers from a low level of depression, which we could also call dysthymia. In addition, his lack of interest has made him feel guilty in the context of his relationship with his wife, and this guilt may further inhibit his desire. In the case of the second problem, the causes are probably medical. He has a long-standing vascular problem, and vascular problems can very commonly result in a problem with maintaining an erection. In addition, he's had episodes of prostatic infections, which made sex painful at that time, and that too can inhibit the ability to maintain an erection. Also, let's remember that medical problems can cause sexual dysfunction, and that these medical problems are very common in older people. However, age by itself does not diminish the interest in sex or the ability to perform it and enjoy it. Steve has had a long series of panic attacks. The first one was very frightening and totally unexpected. In fact, he thought he was having a heart attack and went through an extensive medical workup. Depression and panic attacks often occur together, and notice that Steve also has this element to his history.
I understand that that you've had episodes of a panicky feeling, a high level of anxiety. Could you describe a typical episode?
The first time it happened to me, I was driving down the highway, and I had a kind of a knot in my chest. It felt like I had swallowed something and it got stuck. And it lasted pretty much overnight, and it was really starting to upset me. And then all of a sudden, I felt like I was having a heart attack. I don't know what a heart attack feels like, but I assume that's what was happening because of all the signs. I felt lightheaded, I felt very panicky, a flushed feeling came over my whole body. I felt as though I was going to pass out.
Mm-hmm.
So that's typically how it was.
Okay. Let's get a little bit more details about exactly what sensations occur in one of those attacks. Did you feel short of breath, for example?
Not too short of breath, but somewhat, yeah. I wasn't breathing as though I couldn't breathe. It was more of a feeling like I thought I was just going to pass out. That's how I felt.
Yeah. Did you feel like you needed to get some air?
I did. I stopped. I pulled off the side of the road. I got out of the truck. I walked around. My girlfriend was with me, and she had no idea what was going on. I just stopped on the side of the highway and just walked out, got out of the truck and walked around.
Did you break out in a sweat?
I was feeling kind of nauseous and sweaty. No idea what was going on. So
Did you notice anything about your heart? Was your heart pounding or racing?
Not excessively, no. I really didn't feel that, even though it could have been occurring. I didn't. That wasn't one of the symptoms that stuck out for me.
Mm-hmm. Okay.
But
what did it feel like in terms of psychological symptoms? Did you feel afraid?
I was definitely afraid. I think that's the worst part of it, is not knowing what is happening to you and assuming the worst. You think all kinds of thoughts about what's you know, oh, I've got something definitely wrong here, and I assumed it was a heart attack. So we did. We went to a emergency room, and I got checked out for a heart attack, and they assumed that I was, but everything came back negative.
Some people feel in a vague way like they're about to die.
Oh, I had a long period of time after that I felt as though, especially after seeing a few doctors, my primary care physician had me checked out. I did all types of testing, everything was negative. I had upper GI, I had x-rays, I had a number of things done with no results. I even had some of these panic attacks while I was on the treadmill on the stress test for my heart. And I felt as though, and that was still early in the stages of when I first started having them, and I thought, well, if I'm going to die, I'm going to die on this treadmill. I've got a doctor here anyway.
Let's talk a little bit about the pattern of these attacks. When they first started and when they were at their most intense time, how many did you have during a day or a week?
There were days where I would have a number of them in a single day, and they would come on me sporadically. I had no idea when it would occur. I could be driving down the road. I was on the highway a number of times, and these attacks would hit. And it's so scary because I always felt as though I was going to pass out. That was my worst fear, and run off the road, kill somebody, kill myself. But it was funny, after talking to my mother about it, she said, well, you haven't passed out. And that stuck in my mind. Well, she's right there, you know. So I don't need to fear it as much as I had been. And so I learned to kind of get through it. And even though it was a very frightening experience every time.
Did you ever have one at night that woke you up out of sleep?
I did have some episodes where I would wake up with that feeling in my chest, although it wasn't the flushed kind of a feeling, and which would typically make me feel as though I was going to pass out. That's
Right.
that rushed feeling coming up through my body. But I did have instances where it would wake me up.
Just wake you up out of a dead sleep?
Out of a sleep, I would wake up with the chest.
Is there anything that you could do or not do that would make these attacks more or less frequent?
You know, it was kind of strange. When I first started having these, I was working in a fairly physically strenuous job. And as long as I was keeping busy and working out hard, I didn't notice them that much. But the minute I'd stop and we'd take a break or whatever, I'd start having those feelings again. And but as long as I was physically active, I didn't really notice them.
Well, once you'd had these for a while, did you begin to worry about them, worry about when you were going to have the next one?
Oh yeah, that was definite concern. I tend to stay away from crowded places. I tend to not go out. You know, I've never had a fear of heights or a fear of closed-in places or any type of phobias like that. But it's funny that now I do have a problem with heights.
I want to switch gears just a little bit. Oftentimes when people have these kinds of attacks, they also have feelings of depression. And did you notice feeling depressed when you were during this period of panic attacks?
I didn't see it as a correlation between the two. I didn't realize or put it together myself that there was any relation between the two. I knew that I had depressive feelings before, and that I periodically would have them, but once I started, I think I was feeling depressed at the time that I had the first one.
How old were you when you had the first panic attack that you remember?
39.
39. And how many years ago is that?
That's been about 3 years ago.
About 3 years. That period of time when you were having several per day, how many weeks in a row or how many months in a row did that period of time last?
I'd say a good 6 months.
Is there any other way in which having panic attacks, and I understand they're better now, has had an effect on your life or your friends or family or your job?
Well, having these feelings is, it's number one, you can't seem to shake them. Even though you have an attack and then it subsides, it's still there. It never seems to go away. So it's constantly on your mind. It's just always there. You cannot forget it.
Steve's panic attacks were highly characteristic. He experienced having a lump in his chest. He thought he was going to have a heart attack or even to die. This happened while he was driving his car, and he had to get out of his car to get more air and to walk around. After his panic attack, Steve went through an extensive medical workup, and this is very common in patients with panic disorder. Actually, it's important to do that medical workup because it's very difficult in some patients to distinguish genuine medical problems like heart disease from panic disorder. Also notice that Steve had panic disorder with agoraphobia. What I mean by that is that after he had panic attacks, he began to stay away from or withdraw from situations for fear of having a panic attack in those settings. Steve's symptoms have had a profound effect on his own behavior. Also, he's caused concern for his medical health and concern for his psychological health among his friends and family. Finally, you notice that Steve gave a history of some depression as well. And this is also characteristic. Depression and panic disorder frequently go together. Chuck gives us a classic history for obsessive-compulsive disorder. Once thought to be rare, obsessive-compulsive disorder is now considered to be one of the more common anxiety disorders. It can begin during a person's teenage years.
Thanks for agreeing to come here and talk with us. I know you're having some pain from your back. Mm-hmm. Do you have any other kind of symptoms that are troubling you right now?
I'm a little bit obsessive compulsive. Okay. Sometimes the obsessive part is a little difficult to deal with.
Mm-hmm. Can you tell me what you mean by obsessive compulsive?
The obsessive part, I'll get a thought in my head, mm-hmm. and I cannot put it out. Mm-hmm. It's just there all the time. Mm-hmm. I think about it when I go to bed. I think about it when I get up. It's just hard sometimes to put thoughts to rest.
Mm-hmm. And are there any specific thoughts that are common ones for you that repeat themselves?
Not particularly. Mm-hmm. An example, when I went on vacation, I had to leave my pets with some friends, and I obsessed about it. Mm-hmm. Constantly. Mm-hmm. Should I be doing this? Should I be doing that? Will everything be okay? Maybe I should put them in a kennel. Maybe I should take them over to my friend's house, let them watch them there. Just constantly it was on mm-hmm. my mind.
Mm-hmm. Mm-hmm. So it's uncomfortable for you when that happens?
Yeah.
Mm-hmm. And about how much of the time would you say that you have thoughts like that that are in your head that you wish weren't there?
Pretty much all the time.
Uh-huh. Okay. Are there ever activities that you need to do as a result of having the thoughts in your head?
I'm a checker. Mm-hmm. I have to check things. Mm-hmm. You know, like when I went on vacation and I left my pets at home, it took me 2 hours to get out of the house to leave. I had to check the stove, I had to check the windows, I had to check the cages, make sure everything was okay, then I had to go back and start over again. Uh-huh.
So the thoughts would be there, and in order to appease the thoughts, if you will, you had to go back and check things over and over again. Okay. Do you have to allow yourself extra time?
Yeah, I have to allow myself in the mornings about 10 minutes. I don't cook, mm-hmm. so it's kind of ironic that I have to check the stove every morning because I never cook. Mm-hmm. But I have to check the stove. I'm a smoker, so I have to check, make sure I haven't left any cigarettes anywhere around burning. Mm-hmm. That's not real rational either because I only smoke in the bathroom, mm-hmm. but I still have to check. Mm-hmm. Like I say, I have my pets, I have to check their cages, mm-hmm. make sure they're not out. I have this obsessive thought that one day my bird is going to get out of its cage and it's going to be out in the hallway when I get home from work, because I didn't check to make sure that it was in there. They're not always really rational.
And the thoughts that you have, are they your thoughts? Are they coming from inside your own head? Are they your own thoughts?
Yeah.
They're your own thoughts, but they're repetitive and they bother you, and
Yeah.
if you could stop them, you would. Do you have any anxiety symptoms at those times, such as a pounding heart, palpitations, shortness of breath? anything like
No.
that? Are you somebody in general who has anxiety symptoms?
I get a little stressed out, yeah.
Can you give me an example?
An example at work, you know, the way that things are done in the hospital now is kind of changing. We're losing patients. We don't have as many. So I wonder, well, are they going to close some of the floors? So that adds up to stress. I think that increases the obsessions. I think when I get more stressed, the obsessions become more intense.
Have you ever been depressed before this time?
I haven't been in treatment for the last 2 years, but before that I was in therapy for about 7 years.
And when you were depressed, what symptoms did you have?
Crying spells, hopelessness, helplessness that I couldn't change situations, suicidal thoughts sometimes.
And how long did those symptoms last?
A lot of them lasted a long time. Actually, for most of my adult life, I think that I was depressed and had a lot of those symptoms, but didn't really seek help until about 7 years ago.
And now during that time when you were having depressions, were you also having the obsessions and the compulsions? Okay. And which one started first?
I don't know. It's like they've always been there.
Both the depression and the obsessions and compulsions have been there as long as you can remember?
As long as I can remember, yeah.
Back to childhood? And right now, you said currently you're not depressed.
No, currently I'm not depressed. 7 years of drugs and psychotherapy kind of helped.
How long has it been since you've been depressed?
I'll have 1 or 2 days I might get down, but it's not that overwhelming sense of hopelessness and helplessness. I haven't had that for over 2 years now.
And the obsessions and compulsions have been somewhat alleviated, but really only to a minor extent.
Yeah, they're just kind of there. And like I say, kind of depends upon the situation, my stress level, you know, what's going on. But, you know, I pretty much learned to live with it.
Chuck gives us a clear story of his obsessions and compulsions. He has an elaborate series of checking rituals. He checks to see that his bird is in its cage. He checks to make sure that he hasn't left the stove on. He checks to make sure he hasn't left a cigarette lit in some part of the house. Why does he perform these rituals? He performs them to alleviate his anxiety about his obsessive thoughts. He worries obsessively that something terrible may happen to his apartment or to his pet if it gets out into the hallway. A characteristic feature of obsessive-compulsive disorder is the way in which these rituals can impair a person's life and the amount of time they spend performing them. Another characteristic feature of Chuck's history is that he knows that these rituals are his own thoughts, and yet they are abnormal. If he believed that these thoughts were someone else's or something else's, we would have to consider another diagnosis, such as schizophrenia. Chuck's history also had an element of depression, and depression and obsessive-compulsive disorder often go together. In Chuck's case, we can be certain that he has obsessive-compulsive disorder because his depression ended many years ago, and yet his symptoms of obsessions and compulsions continue up to the present. Etta suffers in a profound way from schizophrenia. Schizophrenia is one of the most severe mental disorders. It's usually a lifelong disorder with periods of psychosis. In some cases, like Etta's, These periods of psychosis can go on uninterrupted for years. Also notice that in Etta's case, her disorganization of thinking is so profound, it makes it difficult to ask about other symptoms.
I want to thank you for coming down this morning, and you and I have had plenty of chance to have conversations before, but this is our first one on video. What went on that you ended up coming into the hospital?
Well, Jesus was giving me all these window crack and screen crack sounds, telling me that they was going to break into the house. So I put the camera stereo in the room where they chiseled the window out to come through the window.
Mm-hmm.
And the camera stereo, the security guards picked that up, the message, by putting that camera in that room.
Mm-hmm. Were you in danger?
Well, if anyone gets into the house, they said I get shot.
Who said?
That's the Eagle.
Can you say a little something about the Eagle?
Well, the Eagle works through General Motors. They have something to do with my General Motors check I get every month.
Mm-hmm. Now you get that check because it's part of your husband's work with GM?
Yes.
Say something more about the relationship between GM and the Eagle.
Well, when you do the 25 of the clock, it means that you leave the house 25 after 1 to mail letters so that they can check on you how you're mailing the mail, and they know where you're at that time.
And who's they?
That's the Eagle.
Okay. And is the Eagle something that is looking out after you, or is there a chance that the Eagle could hurt you?
Well, they're the before on the clock. That's the 6, 7, 8, 9, 10, 11, 12, 1, 2, and 3. They go by those numbers of the clock.
Mm-hmm.
And when you do the 25 after, that's the after side of the clock. We go by the 1, 2, 3, 4, and 5 of the clock.
Mm-hmm.
And the 5, you go right, left to 7 number on the clock is the fire number. You go right, left to that number.
Mm-hmm.
That's what the 25 is. If you don't do something they tell you to do, and Jesus makes the shotgun sound, and then the phone rang, not to answer the phone or the doorbell.
Why not?
Because you get shot.
Who would do the shooting?
The Eagle.
Now, I remember when you first came in, were you seeing some visions on the floor?
No, I was just confused. At first they didn't tell me why I was in there.
Mm-hmm.
But the security guards came and they were very nice to me. I wasn't handcuffed.
Can you say more about the things that were happening at home?
Well, when Jesus made the shotgun sound and then the phone rang, not to answer the phone or the doorbell, I knew it was Jesus talking to me. And he floated, I'd seen a Kmart bag float down from my ceiling to the floor. That's probably what you was thinking about.
Yeah, now tell me about that.
Well, he made the sound of the bag opening up,
Mm-hmm.
And I had my back turned to the bag,
Mm-hmm.
and I was sleeping. And when I heard the bag open, Jesus wanted me to look at the Kmart bag floating down from the ceiling to the floor.
I'm wondering, though, whether these kinds of experiences that you have are really unique to you, whether there's something special about your relationship with Jesus, or whether this is the kind of relationship that other people may be having too.
Well,
what's your personal feeling about that?
Well, I don't like to judge anybody.
I know I'm asking you a tough question. And I don't want to put you in the position of feeling that you're having to brag or put anybody else down. Do you think Jesus answers just anybody's request?
I know that to have that money, that Jesus helps you with it.
Mm-hmm.
So I just trusted in Jesus to help me with that 25. I answered all of his messages. I went and bought notebook paper, and I wrote down the time and what I heard in a sentence.
Mm-hmm.
So that Jesus kept answering my messages.
Etta, are any of your thoughts or actions controlled by Jesus or General Motors or any of these forces?
I was getting messages around the clock
From
Jesus, even 12 o'clock at night. If I heard something in the alley,
mm-hmm.
if I heard dogs barking, I would get up and I would look at the clock, and I would write that down, what time I heard the dog,
Mm-hmm.
just to let Jesus know that I'm answering him.
Now, have you ever had the experience where you heard, besides these noises around the house, have you ever had the experience where you heard the radio or the television talking and you realized that there was a message on there meant for you? Kind of another signal for you.
Yes, I had mentioned to a nurse I was talking to that I ought to get a guard dog when I go home.
Mm-hmm.
And
Now say why that is.
well, and then on the news, I heard that a guard dog killed a child just the other day, and they put the guard dog asleep.
Yeah, what did you think about that?
I think Jesus was sending a message to me.
Could you tell me, what's your mood been like? Or was there a time where you were just sad for weeks?
Well, that shotgun went on from 1990 till now, till the security guards brought me in the hospital.
But I'm wondering whether you got sad and stayed sad.
Well, in a way I was, and then in a way I wasn't, because I trusted in Jesus to protect me.
Okay.
Because the Bible says that God protects widows.
How do you feel now in terms of your mood? Are you sad now?
No, because I don't hear the crack sounds no more.
At any of this time when all this was going on, were you feeling particularly up? Euphoric or high?
I was so busy answering Jesus' message around the clock.
What did you do right after high school?
I went to business school, and I took a course in typing. And I went to Missouri State Employment, and I took a typing test there, and I passed it. And they found my job, and then I got pregnant working, and they let me work 6 months pregnant.
Did you go back to work after the children were older?
No, then my husband died in 1985, and my son was being graduated from 8th grade when he died.
How did you do shopping for groceries, for example?
Well, they said that my son does the grocery shopping, and if he doesn't do the grocery shopping, the house goes to me and my granddaughter.
So that's really a requirement for him,
Yes.
that he does that.
Doing the 25 of the clock.
Okay. Well, he has to stick to that timing too?
Well, he's the before, but he believes in Jesus also.
Mm-hmm.
And he told me, he said, Mom, I don't want to go there. And I said, well, I'll try to help you out.
Go where?
Go left.
Okay. Can you tell me, what was the first time that you had a psychiatric hospitalization? What year was that?
That was in 1975.
Okay. But at that time, were you getting these messages or these signals and the involvement with Jesus and GM and all of that?
No, because my children were going to school, and I was busy helping them with their work.
Okay. Etta, in 1975, when you got hospitalized, in your mind, what was that about? Why did you get hospitalized?
Well, I seen Dr. Krojanker there, and he gave me Thorazine because my son was 2 years old, and a child can get on your nerves when they climb and want to get into everything. And then I had to cope with the teachers at school they wanted me, to help my child with homework. And then my son was 2 years old. He was getting into everything, That kept me busy.
Right. I think you also mentioned your in-laws had moved in.
Yeah.
And that was also a stress.
Yes.
In what ways did these stresses show? And what kinds of things were happening to you that made it so that you had to go into the hospital?
Well, I would break out with a rash, and one of the nurses told me it comes from your nerves if you break out with a rash. And I would itch,
Okay. Did you feel depressed at that time?
Well,
have you been able to enjoy yourself at all, have fun since 1990?
well, I think I spent all my time writing messages what Jesus gave me, so he would keep giving me messages.
Well, what happened to things that you used to do for fun?
Well, you really don't have no fun when you got a shotgun behind your head.
Yeah, okay. And I want to thank you very much.
I hope I did all right.
Etta's most profound symptom is her disorganization of thinking. In addition, though, she has many delusions. She believes that Jesus communicates to her in the sounds of barking dogs or firing guns. She has to follow these instructions, or else she'll be killed by some unknown group of people. It's very hard to know if Etta is experiencing hallucinations, because it's hard to know whether the sounds she hears are really there or hallucinated. All of these symptoms we've described so far we could call positive. That is, they're abnormal experiences that ordinary people don't have. But Etta also has negative symptoms. Negative symptoms represent a lack or a diminished capacity of a normal experience or behavior. In Etta's case, her negative symptoms are a lack of interest in social life, a diminished ability to express her own emotions, and a sense of being disconnected from other people, as we could see very clearly in the interview. Etta's illness also has to be distinguished from bipolar illness and from schizoaffective disorder. In Etta's case, we can be confident that she has schizophrenia because she has had long periods of uninterrupted psychosis in the absence of any change in mood. You may have noticed that Etta's hands moved in a strange way. Although schizophrenic patients can have odd mannerisms, her movements were most likely tardive dyskinesia, that is, an abnormal movement caused by the antipsychotic medication she has taken in the past. Finally, it's important to remember that schizophrenia does not discriminate on the basis of gender or socioeconomic class. It affects men and women equally, and it affects people from all walks of life. Schizophrenia and other severe mental disorders are increasingly being thought of as brain disorders. For this and other reasons, it's become increasingly important to understand how psychiatric or psychological symptoms could come from an injury to the brain. Our next person, Mike, has had a brain injury and has a variety of psychiatric symptoms. In particular, notice the odd pattern of Mike's speech.
Now, I remember we met each other when you were first hospitalized. And do you remember why you were hospitalized at that time?
Well, I had an accident down in Paducah, Kentucky. I used to race an off-road vehicle, a Jeep that I built myself, built the frame, the engine, had a fiberglass body on, and used to off-road race it, normally in a 300-foot drag race. But their idea of which, at the time down in Paducah, Kentucky, I was thinking, wow, I'm going big time, I can do some traveling. But their idea of a track was this X-horse racing track, which for their so-called guardrails was just plastic pipe. Now, my engine at a later date was dyno tested, and it made 1,000 horsepower, a six-cylinder, which I was very proud of, but at the time, I guess to control it, I tried to use their so-called guardrail. Went through the plastic pipe, which even having a full-face helmet on, it had the chin guard and everything, this broke, and also broke my jaw and knocked a lot of my teeth out at the time, and also gave me the head injury, which is many major memory problems I've had and still got to this date. Even though it's been over 3 years ago now, I still have a pretty major memory problem, which has since brought about a divorce, and which I now have a new girlfriend, which helps very much. I even call her, kind of nickname her, my new brain or my new memory. Tease her a little bit about that if I want to know something, besides relying on to this so-called memory notebook, which I jot notes down in constantly and have it every day dated, so I know what's coming up or what's for that day. She also helps very much with the memory. My mother types up the pages for this notebook, which has each half hour down and the date, the day and the date, which anything coming in within an hour or two or the next day or next week, I can make a note of it so that when that morning comes and I wake up, I right away, one of the first things is look at the notebook. What have I got to do today?
So it's your memory for things like a shopping list that's been most affected?
That is one of the things, and most of the time, which I have built 2 race engines since the accident, which that is called overlearned memory, which I had done that for 13 years. So yes, I can build race engines still, but any new learning, whether it's directions to go to this place or even to a bank. I've changed banks, and to get to that bank, well, where am I going to go? I kind of need some money today. Didn't know where to go, but the bank I am now with is right next to or across the street from a previous employer. So, well, it's out by this so-and-so place. Yep, then it kind of comes back.
I think I remember that you tried to go back to work in an auto shop after the accident. Can you talk about that and what happened?
The only place that I do remember, this is coming up again, but the only place I do remember is trying it again at Bigfoot 4-Wheel Drive, which was a previous place of employment. But instead of, which I used to build the enormous trucks that they have and the engines for. And because of their being scared, which I do not blame them, they did not have me build the engines for the trucks anymore. They had me doing this janitor work, I call it, dumping the trash, mopping the floors, and that really got me down a little bit, got me depressed, which I think is understandable after being that high up, so to speak, and now doing that low type of a job.
How did you handle that at the time?
I handled that with all types of things, just being angry in general.
Really, you and I met, gosh, when was it? Back, well, your hospitalization was over a year ago, wasn't it?
Got me. I've got the memory problem,
Right.
so I'm not for sure on that.
Okay. And when you first came in, do you remember the problems you were having when you came into the hospital?
I know I went through a suicidal deal originally, which the medication and of your help has done wonders. And, that's the farthest thing from what mind I have left. That's the farthest thing from it right now. So that's would be the only thing. That's one of the major things that stands out in what mind I have left.
Yeah. Now, you were depressed at the time. Do you remember that?
Yes. Because of the divorce and selling the home in Lake St. Louis.
Do you think before the accident that if you had gotten this kind of terrible news, divorce, losing the house, that you would have felt suicidal?
No, I wouldn't have, because I was in a much better state at the time with the employment, and not exactly sure how it would came out, whether I think I would have been able to keep the home, and things would have just went a lot smoother.
Mm-hmm.
That I still would have been disappointed losing the wife, but it was in more of a state that I could handle it.
Mm-hmm. Do you know whether you've ever had any depression or suicidal feeling prior to the accident?
Never ever before. That I've always had a very nice vehicle, just a drive-around type vehicle, and also added to with, like I talked earlier about the race vehicle. One of the first jobs was American Engineering in St. Charles, where I did also engine work there. Somewhat got me the place of employment down at the other race engine place. So everything kind of somewhat fell into play.
Mm-hmm.
That one thing led to another, always graduating up.
Talk to me a little bit about having problems where your temper would get out of control.
And that was the understanding of mine, which brought about the divorce,
Mm-hmm.
which now the new girlfriend I have doesn't see any problems with the temper.
Mm-hmm. Remember what happened when you first woke up after the injury?
That I do not, although I do have a list at home which I am intending on getting rid of here shortly, that my mother had made for me, that she's got somewhat of a list made that mother is Betty so-and-so, and my father is Jack, and then each brother and my sister and their children that they may have is all listed on this list, so that I would become acquainted with more. If they were coming over, would call and going to come over and visit, then I could say, oh, yeah, this such and such brother, he's married to so-and-so, and they have this many children, and their names are on down the list.
Do you remember blaming yourself for anything that happened or feeling guilty?
I do kind of. I'm trying to think what it is. Oh, yes. Another accident?
Mike, can you remember those three objects that I asked you to recall about 5 minutes ago?
Apple, chair, and watch.
That's good. Can you tell me how you did it?
Like I had talked about earlier, repetition. Even though we were discussing various things in between, I just kept repeating over and over, even though I had done some talking, thinking over and over to myself, repeating them, three things, over to myself, so that yes, when you asked again, I could let you know.
What about your ability to enjoy things?
It just takes a long time. Sure that in many cases it's a different amount of time, but if we keep our hope up, which I have recently with the medication that you have prescribed, doctor, has done wonders, and I've kept my hope up. It all becomes okay. I've got my guns back now. I'm getting ready to go deer hunting next week, and just everything seems to have cooled down with the family even. They do not worry about me as much, and just the traveling even that I do. I've got my own vehicle, and if I take off and go somewhere, yes, I can find my own way,
So
and
these are
which I
places-
do kind of pat myself on the back. Yeah, I did it myself.
The most direct and obvious consequence of Mike's brain injury is his amnesia. For this reason, we can give him the DSM-IV diagnosis of amnestic disorder due to a general medical condition. In particular, Mike has lost the ability to learn and remember new things. In addition, Mike probably has indirect consequences of his brain injury. These include his odd pattern of speech, his diminished ability to show his own emotions, which is really not that different from what we see in schizophrenia. He also has had past episodes of rage and past episodes of depression. In Mike's case, and often, it's very difficult to say the degree to which these other problems stem directly from his brain injury or from the losses that he suffered after his brain injury. These losses were profound and included his home, his marriage, and his occupation. George gives us a classic history for antisocial personality disorder, one of the most severe and disturbing personality disorders. His problems began at an early age, and they affect not only him, but almost everyone around him.
Can you tell me a little bit about what's happened for you to come into the hospital this time?
Yeah, this is my first time coming to the hospital or a treatment center, period. And I got to the point, I was selling drugs out on the street, dealing with a lot of people, crazy people and everything, which, because they had a sickness. But I didn't know I had a sickness because I was always, distributing it to them. And I just got to a point where I had my mind just got so bad and everything. I couldn't nobody tell me nothing. And I ain't care about nobody. I ain't care about myself. I ain't care about my mother, my father, my kids, and nothing. So it was like, it got so bad where I had to put a gun up to my father's head and then putting my hands out on my mother's face, calling her all out her name. And it was like anybody could have took me out. And if they would have shot me or killed me, I wouldn't have cared.
When you were telling me when you were younger, under 15, you had all those fights, you ever have a fight with a weapon? That you were carrying a gun or a knife?
A knife?
A knife.
Yeah.
That was when you were under 15?
Yeah, that's when I was little. I had, my mother, since she been working the course, that gave me a break on the case like that. But I ain't got caught with 13-inch switchblades, throwing knives and everything. I ain't caught a lot of different things like that.
How old were you when that happened?
Like 11 to 12 years old. Used to throw bricks at people and bust their heads, hit them with bottles and everything. I ain't care. Whatever it took to beat them, that's what I did.
Now, when you were doing that, were you really trying to hurt him?
Yeah, I was trying to hurt him. Because, like I said, I didn't have no feelings for nobody. When I felt like killing somebody, before I came in this hospital, when I felt like killing somebody, I didn't care about it.
When you were younger, less than 15, did you ever destroy property?
I used to see the bus drivers coming down Grand Avenue and once they opened the bus door, throw bricks at them and everything, then run.
How old were you when this happened?
10 and 11 years old. I was right down the street from the house, so I ain't had that far to run. One time I took a paper machine, once they had the papers in, I took it and dragged it in the boys club, busted it open, took the money out.
Out of the machine?
Yeah, how you break the machine, that it has a top. I broke the top off and took the money out of the machine.
Was that something you do a lot when you were younger too, lying to people?
Yeah, lying to get out of a whooping.
Okay, how about at school? Lying at school? And
yeah, I was lying daily at school because, I go back to school, why weren't you at home? Why weren't you at school? I was sick. go home. My mom was like, was you at school today? Yes, ma'am, I was at school. No, and I wasn't even at school. I was at home on the telephone watching TV, legs kicked up and everything.
Hmm. Now, how about fires? I know I asked you that
Yeah,
question.
I ain't do no major fires like burning buildings up and nothing, but I ain't tell you the other day, you know, I used to set trash cans on fire, right?
Now, were you doing that to keep warm, or?
No, doing that just to see some fire, just for the hell of it.
So if it was important, valuable stuff in there, you didn't care.
No, I used to steal from my daddy too, like his knives and stuff. My mother has a comic book collection,
Mm-hmm.
and you know, from when they very first started making comic books,
Mm-hmm.
when I was in school. I mean, when my mother and them didn't get no money, I used to take our comic books to school and sell our comic books. I mean, comic books that was valuable, real
Mm-hmm.
valuable. I used to sell them just for nothing. But she got them back though.
Mm-hmm.
But you know, I ain't as I was. You know, I didn't.
How about torturing animals or doing things to animals?
I ain't never abused no animals because, no, I always did love animals because we always had animals.
Mm-hmm.
We always had pets, cats and dogs and everything, so and I used to have a rabbit, you know, I love animals. I wouldn't do nothing to no animal, but I do something to a person. I have hatred inside me. I don't care how much I beat somebody, I still don't get enough anger out because I still seem like the more I hit somebody, the more anger I get inside me.
How much anger do you think you got inside you? What could you do? If you could just do whatever you want, how much anger would come out?
All right, put it like this. The other day, okay, before you came and talked to me, I was laying in my bed, and a guy that sleeps next to me, he just was talking to me, and I got pissed off and told him don't say nothing else to me. So I had jumped up out the bed. Now, this is in the hospital.
Mm-hmm.
Jumped up out the bed, and he jumped up. I just slammed him on his bed and started choking him, you know, and didn't want to let go. I mean, you know, it was like, I was just looking at his face and just choking him. And when so then some nurses came there, gave me some medicine, calmed me down, right?
Mm-hmm.
But before the medicine calmed me down, he said something else to me. I hit him. You know, then you know, the medicine finally calmed me down a little bit.
When was the first time that you really started using drugs?
I used drugs when I was praying. Ooh, let me see. I was probably about 9, 10 years old.
What kind of drug?
Smoked marijuana. And then, no, that's the first time I used a drug that I smoked, but alcohol is a drug too.
Mm-hmm.
First time I drank some alcohol, I think I was probably about 3 years old. My mother, she used to drink peppermint schnapps. This was, you know, now this was like almost 24 years ago.
Mm-hmm.
And I took a bottle of her peppermint schnapps and drunk it. I hid in the closet and drunk it. I was sick. My mother told me I was sick for like 4 or 5 days.
How old were you when you first started using it, though, to get drunk or to get high, using drugs?
First started, I was smoking marijuana when I was about like 10, 11 years old, 9, 10, something like that. Smoking marijuana in school, you know how everybody wants to be grown.
Have you ever forced a woman to have sex?
No, see, I have sisters and I respect them. I respect all females. I wouldn't put myself in no category to, I know people that did it though, and I wanted to kill them. You know, because I feel like a man doesn't have to do that, you know.
The kind of work that you've done, you mentioned that at one point you were selling drugs. Is that the main kind of work that you've done before? Selling drugs?
Yeah.
Most of the things most of the jobs that you've done, have they been things that weren't legal?
Yeah, I had a company though. I actually owned my own company though. I had a construction company, and you know it was an up and down thing. You know, the weather was bad, you couldn't do it. I actually opened that company up because I got the skills and the trades from Job Corps.
Mm-hmm.
So I had opened that company up, and I had got locked up. You know, I got locked up by the state. So when I got locked up by the state, I was just.
No, you mean you were in prison?
Yeah.
Prison. What was that about?
I assaulted a woman, you know, because she got up in my face and she acted like she was finna hit me. She was talking, but she was arguing with me, and next thing I know, I just smacked her. I broke her nose. I had so much anger and stuff in me. It was just, I just was like a bomb. You know, you see a bomb and it's just ticking. It's just a matter of seconds before this bomb blows up and you trying to get out of there.
Mm-hmm.
and the way I'm going, that bomb's gonna blow up in me. I won't be able to get away from it. And then I can't.
What's going to happen, you think, when that bomb's going to blow up?
It's gonna be a lot of people hurt. If not a lot of people dead.
Mm-hmm.
Now, I might be one of the persons that's lying in my grave or something, but you know, I ain't gonna go out. Hey, I'm not going out without taking somebody with me.
Has it ever happened that you've actually shot or killed someone?
Yeah, I don't know if I killed them. No, I shot a lot of people.
A lot of people, more than one.
Oh yeah, I was staying on the south side, and a guy stole my car, and I knew who it was who stole it. Then he came down the street, and I had a sawed-off 410. And I shot him with that 410.
Shotgun?
Yeah, I shot him. Then this is the same week, a lady tried to set me up with the police. She was working for the police, and you know, she came there with marked money, and I stayed on the second floor. I had threw her off the second floor, broke all her ribs. But you know, I've been doing a lot better though. You know, because I respect everybody up here, because everybody's trying to work with me. They could have been like a lot of these hospitals. You don't have insurance? Fuck you. You gone. We cannot help you. Okay? But these staff up here, you know I done hurt a lot of them because I done cussed them out, threatened them. But you know, they didn't let it get to them. They still helped me.
Well, we've been trying to help. That's one of the things we're doing. We're trying to help you while you're here. And you helping us with this film is really helping us a lot, too.
Right. You know, I just want everybody to know, you know, if I can get cured, anybody can get cured.
George gives us one of our most dramatic interviews. The key to making the diagnosis of antisocial personality disorder is to document the onset of certain symptoms before the age of 15. These include failure to conform to social norms, aggressiveness, irresponsible behavior, impulsive behavior, lying and other deceitful behavior, dangerous behavior, and finally a gross lack of remorse. In short, George has them all. These symptoms have continued and intensified in George's adulthood. One of the most ironic things about this interview is George's charming and engaging qualities. Perhaps this is the reason that patients with antisocial personality disorder are often given second and third chances. We can't forget the profound and sometimes dangerous consequences that George's behavior can have for his family, his friends, and in many treatment settings. Finally, we have to recognize that George's prognosis is poor. This disorder is often lifelong, and many treatments are unsuccessful. Sadly, George has little insight into this, as his final comment shows. Tim has alcohol dependence. He also has many of the characteristics of alcohol abuse. Taken together, these two disorders probably represent the most common mental disorder in the United States. Notice, too, that like so many of our other interviews, Tim tells us a story of depression.
For you, in a typical week, how much drinking would you do?
2.5 cases.
2.5 cases of beer?
Sure, yeah. Mostly beer.
Mostly beer. So hard liquor, other things like that, that's not something that you'd usually drink?
No. Not usually.
Has it happened that you've been in treatment programs for drinking too much in the past?
Sure.
Okay. How did that go? How did those programs work for you?
I don't think they do. I think that if you're going to quit, just go to AA or put on your own or move. All the treatment program does is get you away from your drinking buddies. So if it's cheaper to move and go to AA.
Do you remember what was going on in your life back then that made you think you had a problem with drinking?
Court system.
The court system. Okay, you had some problems with the courts?
All the time.
What kinds of things were going on?
Get arrested for assaults, drunk in public, DUI, whatever.
So you've had some DWIs?
Sure, 2 of them.
Okay, 2 of them. And also doing a lot of drinking and then getting into fights?
That's right.
Okay. And what's some other problems you've had because of drinking?
Family problems.
Family problems?
Sure.
What kind of family problems?
Don't get along with anyone in my family.
Have you noticed that you've needed more and more alcohol to get high, to feel the same effect that you did before?
For a while, yeah, but now it's less. Takes less to, I think you go up and you come down.
Mm-hmm. Or a time when you were drinking the same amount, but it didn't seem to have the same effect? In other words, you couldn't get as drunk or as high as you did before?
Yeah, it's the same thing. It takes more and more and more.
Mm-hmm.
And then I guess after you get to the top of the hill, it takes less and less as you go down the other side.
Sometimes when people drink a lot and then they stop kind of abruptly, you have withdrawal symptoms.
Yeah, if you stop right, like if you drank a case and a half in one night, and the next day you didn't drink nothing, yeah, you'd feel it.
Mm-hmm.
It'd be a hangover that you'd feel.
When you've had a long night of drinking and you wake up in the morning and you have a really bad hangover, have you drunk in the morning to get over the hangover?
Yeah. Oh, yeah. I always save 2 or 3. If I'm sick or real shaky, whatever you want to call it, I'll drink 2 or 3 of them, and then I'll go
2 or 3 beers?
Yeah, go lay back down for a while, then I'll get up and do what I got to do.
And this would be at 8 o'clock in the morning or 9? Or?
It could be 5 o'clock in the morning, it depends what time I woke up.
Mm-hmm. Did you feel nervous or get sick to your stomach or have shakes in your hands?
1 or 2 days.
For 1 or 2 days?
That's it. After that, then I'm back to normal.
How many times in your life have you had blackouts?
Probably about 40 or 50 times that I can remember.
Mm-hmm.
That, somebody say something about it that I didn't remember.
Do you remember ever did anyone ever tell you that you tried to do something to hurt yourself or harm yourself during one of those blackout times?
No, I don't really. Well, I don't know. Yeah, I guess so. Yeah, I guess so. Tried to blow up a double tanker gasoline truck.
You tried to do what?
Blow up a double tank gasoline truck.
When you were during a blackout period?
Yeah.
How did you try to blow up the truck?
Well, the guy was putting the gas in the ground. I struck my lighter and stuck it on the hose. He took off running, and my friend ran across the street and threw me over his shoulder and took me back to the house.
Mm-hmm.
So I would say that's trying to hurt myself and somebody else also. Probably half the city, probably.
Has there been a time when you've noticed that you've spent a lot of your activities doing things around alcohol? More and more time, let's say, drinking or thinking about drinking or thinking about ways to get money to buy alcohol.
Sure.
That's happened.
That happens a lot. Even now, if I want to drink beer, I'll drink it wherever I am.
Mm-hmm.
It doesn't matter. It's going to be there.
How about other things, relationships with people, friends or family members? Did you kind of, over time, cut those things out and put drinking in its place?
You don't go out. You don't go to movies. You don't, whatever. Myself, I built an entertainment center in my home so that I could stay home and drink. You can't go to movies and drink. You can't smoke. You can't anything at the movies. So you just make it in your home.
Mm-hmm.
That's a good excuse anyways.
How about relationships with people?
Yeah, I've lost a lot of friends.
You've lost friends who drinking?
Sure. But yeah, you keep drinking. It doesn't matter.
How have your relationships been with women?
Not too good. I don't know what it is. I guess they want things I don't want, and I want things they don't want. Because it takes 2 to tango, regardless.
Mm-hmm. What kind of problems have you had in your relationships with women?
I haven't really been having any serious relationships since my ex-girlfriend left me. And that was in '91. And
It was a couple of years ago.
Yeah, I've been pretty much to myself. I don't associate with hardly anybody anymore. Mm-hmm. I don't need it.
How about problems with jobs? Problems at work because of drinking?
I have a lot of problems keeping a job, but I don't think it's through drinking. And that's not it, because I show up on time and I'm there all the time. It's the people. I don't get along with the people.
The people there.
Yeah.
And has it happened that you've gone to work on time but drunk, or you'll take breaks from work to go drinking, come back to work?
No, I don't do that on a job.
Okay, so once you get to work, you won't drink after you get there?
That's right. I don't like to drink before I get there.
Or before?
Right, I'll wait till I get home. That's your job. You have to keep that, or else you can't drink, right?
Mm-hmm. Has there been times when you still kept drinking, even though you felt that it was doing you harm in some way? Maybe your health, maybe relationships with people in your family?
Sure, you don't care when you're drinking, though. When I drink, it's like I don't care about anything as long as I'm drinking. nothing bothers me. The world doesn't bother me.
Mhm.
So when I'm not drinking, the problems come back. So you drink again, the problems will go away. But they keep coming back. The problems will always be there. You just don't realize it while you're drinking. And so that's why I think people tend to drink a lot.
Have you had any physical problems because of alcohol?
No.
Problems with your liver, or
No, I'm in good health.
if you did, do you think that you'd still keep drinking anyway?
Yeah. Yeah, I think I always drink beer. Always. I like it.
If you can just tell me a little bit about what happened for you to come into the hospital.
To come here, kind of feeling homicidal and suicidal, I guess. And so I called somebody to talk to them on a crisis line. They couldn't give me answers on the phone, so they told me to come down and see somebody. I did, and now I'm here. I'm still here.
It sounds like you were really very upset.
Yeah,
You think about killing yourself and killing other people.
yeah.
What was going on?
Just like the last straw that broke the camel's back, I guess. Just too much builds up on you. After a while, you can't take it. So, you know, I don't know. I was supposed to be on medication anyways and wasn't taking it, and I think that might have something to do with it.
What kind of medicine were you supposed to be on?
Damn, I'm trying to... Just antidepressants and something to help keep me calmed down, I guess.
I see. So it sounds like in the past you've had problems feeling depressed.
Yeah.
What's that been like for you?
Bad.
Bad.
Yeah, bad.
And that's happened just before you came here?
Yeah, well, yeah, I've been dealing with depression for, I think, all my life. But with the doctors since about the beginning of '91, I think.
When you look back on it, did that kind of start at the same time the drinking started, or did it start before or after?
I really couldn't tell you, because I've been, like I said, I've been drinking since I was 11. And I can't really remember too much before that. And so, I don't know. You know, maybe, I don't know. I guess I've felt down and out all my life. I can't really remember being an overjoyful child. So.
How about nervous, just in general? You mentioned kind of feeling depressed. How about just feeling real nervous and fearful, like something's going to happen?
Yeah. Oh, I'm always like that.
You're always like that?
I had one doctor tell me he thought I was paranoid. But I don't know if that's the case. Every other doctor just associates it with being depressed.
You know, depression's different for different people, how it hits them. How does it for you? How does it bother you when you start to feel depressed?
I think I got a word for it. I had to write it down because I didn't know it. Forlorn.
Forlorn?
Do you understand that?
Yeah. What does that word mean for you?
Unloved, unwanted, nobody cares. That's about it. It's a small word to describe all of that.
It describes a lot.
Yeah, it does. And that's about how I feel. I've never heard of the word until this morning, so, you know, I'm not college educated. And I think the alcohol had something to do with that, too. So.
No, but that's a very strong description that you give there. So you feel really kind of down on yourself, bad about yourself?
Sure. I mean, there ain't nothing I can do about it. I can't change my thoughts. Just try to get over it, I guess, or tough it out.
First of all, Tim shows us many of the features of alcohol abuse. He describes continuing to use alcohol despite the fact that it's caused many failures in his life. Also, he's described using it in situations where it was clearly dangerous. He also complains that alcohol has caused him many problems with the court and with the law. Finally, he describes using alcohol despite the fact that he knows that it's damaged many of his interpersonal relationships. In addition, Tim also shows us many features of tolerance and physical dependence. He describes that at times he has required more alcohol to get the same effect. Also note that Tim, like so many of our other patients, describes depression. However, in somebody with depression who is drinking, it is very difficult to determine whether the depression might be directly due to his use of alcohol or whether it might be due to a separate and distinct mood disorder. In Tim's case, it will take many months of him remaining sober for us to tell whether he has a separate and distinct depression. Although Tim says that he thinks that alcohol may be responsible for him not progressing in school, we know that alcoholism does not discriminate between socioeconomic classes. Again, this disorder, like so many others, affects people in all walks of life. Finally, it's sad to note that Tim has poor insight into the seriousness of his problem and into his need for treatment. Susan suffers from anorexia nervosa. This serious disorder, although it can occur in both men and women, is far more common in women than men. In Susan's case, it has had a profound effect on her sense of self and on her relationships with other people.
I understand that you have some difficulties eating and with your eating habits. Could you just describe them for us?
Yeah, basically it's, I don't want to eat because it seems like as soon as I eat, I just gain weight, get fat. Look bulgy to me anyway, so that only makes it worse. But then there's sometimes where, you know, I can't stop it, I have to, and then once I eat, regardless of the amount, there's a strong urge to either purge or take laxatives or something along those lines.
Is it a particular number of pounds that you're aware of? You say that you're worried about your weight.
I guess you could say that the only problem is that it never stops. You know, you start at a weight, it becomes very obsessive, where you're getting on the scale 10 times a day.
How much do you weigh?
Well, I weigh 96 pounds now.
Are you aware of, for your height and build, what your so-called ideal weight might be?
No, not really. There was a time where I thought that I had it under control, and I wasn't getting on the scale at all, and eating regular meals. And I know that at that point I was 118 pounds, and that's probably a good weight for me. I remember feeling okay there when I was there.
And do you notice that as you lose more weight, does your concern lessen about the weight, or does it grow larger?
It grows larger.
So the lower down you go in terms of your weight, your concern about it and the drive to lose even more actually increases.
Right.
Is that what I'm understanding?
That's right.
How is it that you come to gain weight from time to time?
Most of the time it has to do with some sort of social situation where I actually draw more attention to myself if I don't eat. Like a birthday weekend that I just had a couple of weekends ago. And I'm a chocolate freak, so that's what they do, you know, and you fix you your favorite foods, and they, you know, just give you all this stuff. And then you almost have to eat it, because if you don't, you're drawing more attention to yourself. Mm-hmm. So it becomes out of control. It's almost like, since I can't monitor and not eat it, I eat it all. And then I have to take care of it somehow later.
When you gain weight like that, what feeling does that give you?
Frustrated, angry, feeling worthless. Yeah, I guess that comes from a lot of things. Number one, just because you're allowing, all of a sudden you realize that you gave control to someone else, you know, and you gave up control. You couldn't even monitor it.
I want to go back and ask again about another detail. You said that you have to get rid of weight when you gain it. How do you do that?
Usually I try and throw up, and sometimes I'm successful at that and I feel better and it's fine. Sometimes I can't throw it up for whatever reason, I don't know. So then it's, if I can, it can be exercise. Like on a weekend, if I don't have anything planned, I'll probably work out for 2 hours. But if it's like a work situation where I'm at work and we had a birthday party and I can't, then it's a laxative.
You use the word obsession. Is that the sense of it that you have?
Yeah, I think that's very much it. It's so shallow. I guess that's so aggravating when you realize that, because you are going to gain a pound. If not today, it'll be tomorrow. And pretty soon you're going to get looking real fat again and you're going to be worthless.
Even when you lose pounds, you still you feel like your body doesn't look right or feel right, or
Real bulgy.
what is it that you notice, or how in what way does your body not feel right?
It feels fat. And when I look in the mirror, especially around the stomach and the hips and the back end and around up here, it just looks fat. It hangs almost like I'm pregnant.
What's the lowest weight you've ever gotten down to?
I got down to 87 pounds in the early 20s. That's when it was the worst. That was probably the worst bout of it that I had.
How about your periods? Are they regular, or is that does that stop when you lose weight? Do they stop?
Yeah, it has, and I'm real frustrated that it hasn't stopped this time yet, because that tells me that I need to lose more weight still, because there's some sort of connection there with if you lose enough weight and have enough that your body fat is so low you don't have a period. Well, if I'm still having a period, that means that I have enough body fat, obviously, so I still need to lose some.
Can you tell us how this all began and how it's waxed and waned over the years?
I guess there were periods of it actually when I was in grade school. And it seemed to kind of be triggered, like, if you get a flu or whatever, and, you can't keep food in your stomach for a couple of days, and then you get the comments of, oh, yeah, you lost weight. And so I would get into a cycle of some kind. I learned how to throw up. But it was never prolonged. I mean, I don't think it ever lasted even a year. I don't think I could, because, you can't hide that kind of stuff when you're in grade school and still living with your family and parents and things. And then actually over the years it just got more pronounced. I think it got really bad when I finally went away to undergrad, because there was nobody watching me, and so I was free to be able just to continue it and continue it.
Do you notice any relationship between your mood, how you're feeling, and the weight that you are?
Yeah. I'm trying to, okay, well, I don't know if it doesn't make sense, you'll ask me about it, but it's kind of like, I noticed that I start to become real depressed, usually. Probably to a point where it becomes really clinically significant. And I naturally lose an appetite during that time. And then I notice that, as I start losing more and more weight, that I start feeling better.
What was your mood like when you weighed 118 pounds?
I was doing fine then. I think some of it had to do with just things that I had accomplished in my life, because at that point I did get the master's, which I thought I never would. I found a job, which I thought I never would. And so just being able to have that income coming in, and the fact that I knew I would now be financially independent and not depending on anybody, and I've made these accomplishments, I was just gung-ho. It was like, okay, now let's get into this job. You're an important person now. It's just that it didn't last, I guess.
You talked about having mixed feelings, about having people pay attention to your eating problems, and about being in control of situations. And yet here we are, being videotaped. How do you feel about that?
There's a whole bunch of conflicting feelings. I think when it was first talked about, it was like, oh wow, like, oh, I'm a celebrity of some kind. I finally made an accomplishment. To but I'm going to be real embarrassed to walk in there because the first thing that they're going to see is, no, we didn't want binging problems, we wanted anorexic problems. And I'm not skinny enough to be an anorexic yet. So there was some real fears about that. And then there was also some, I don't know, I guess I allowed myself to feel good because this is probably the first time that I've ever said, okay, yeah, you have an eating disorder. There's been some cycles to it. But before, in the past, I never even admitted it. It was like, you know, no. I know that, you know, I try to make myself throw up, but I'm not, you know, trying to kill myself or anything like that, which is probably what anorexics are doing, you know. So it's only this particular cycle that I finally accepted the fact that it's an eating disorder, you know, when you don't want to eat. And then when you do eat, you feel like you need to take care of it. That's an eating disorder, Susan. So there was some kind of, just kind of like a feeling good inside that I finally admitted that.
Being here is part of acknowledging.
I guess.
Susan shows us so many of the tragic features of anorexia nervosa. First of all, there's a refusal to maintain her body weight. If we assume that her ideal weight is somewhere around 118 pounds, at the present time she's about 80% of that weight, and at times we know she's weighed considerably less. In addition, she has an obsessive fear of gaining any additional weight. She also has a clearly distorted body image, thinking that she's fat because the flesh hangs from bony limbs. Finally, although she doesn't have amenorrhea now, she hopes to produce this other problem as a mark of success. Amenorrhea is defined as missing at least 3 normal periods in a row. It's difficult to really see Susan's body because, like so many people with anorexia, she's covered her body with many layers of clothing. We should also consider which of the 2 subtypes of anorexia Susan may have. There are 2, restrictive type and binge-eating, purging subtype. Because of Susan's preoccupation with purging behavior, we can say that she has the binge-eating, purging subtype of anorexia. Also, this interview demonstrates the mystery of this disorder. Why, when she weighed 118 pounds, did the cycle of losing weight begin again? She seemed to be feeling well, her life was at a high point, and yet some factor or combination of factors that we can only guess at began the cycle again. Finally, we have to admit that this disorder is among the most frustrating to treat, perhaps because people who have it have so many talents and so much potential. We think that the prognosis should be good. However, in some cases, with ineffective treatment and an inevitable loss of weight, the outcome can actually be fatal. What we've tried to do in making this film is to show you the characteristic symptoms of 10 real patients. In addition to describing how we've grouped their symptoms together to make a particular diagnosis, we've also tried to discuss how other diagnoses were excluded. In some cases, we tried to determine whether patients met the criteria for a particular subtype of a disorder. We've also tried to discuss the way in which each of these symptoms affects the person's behavior and their interactions with their friends and their family. Let me remind you that diagnosis is an evolving effort. While the symptoms that you saw described will probably be very much the same in the next 5 years,